If I sound kind of out of it today, it's because I finally had my kidney stone surgery yesterday. It was delayed a couple of weeks because of Tropical Storm Hillary that rolled in and just washed out all the streets. It hit on a Sunday and my surgery was scheduled for Monday. But on Sunday, I got a call from the surgical center saying that they were closing, that the city had asked them to close because of all the flooding and knowing that, most of the streets, or a lot of the streets would be closed and no one would be able to get there anyway. So it got rescheduled for yesterday. It went well, but I'm still feeling a little bit queasy, a little bit dizzy when I stand up. Fortunately, I'm not feeling any pain. They gave me some really strong painkillers in case I needed them, but I'm happy to say that I've had almost no pain at all. I mean, I've had this done, 3, 4 times already over the last 30, 40 years, and I've never had to take any pain medication afterwards. I do get really nauseous though afterwards, and apparently that is one of the side effects. And I was telling one of the nurses, and she said, or maybe it was the anesthesiologist, and he said that they would give me something, to counteract the nausea and the vomiting afterwards. And apparently it's not uncommon. I mean, the last couple of times I remember when I had this, Jim brought me home, and you're only supposed to eat like broth or water, and that's all I was eating. But right away after I started eating just chicken broth, I threw up and then I passed out. And that happened the last 2 times. So I was a little worried it might happen again, but since I talked to them about it and they said they were definitely giving me something, whatever it is, to counteract that it wouldn't be a problem this time, and it wasn't. After the surgery yesterday, I felt like I had laryngitis. I could hardly speak at all. And even today, this is about as loud as I can speak, and I do feel like it's getting a lot better. Yesterday, I don't think I could have done this video yesterday because you wouldn't have been able to hear anything I was saying. And it's caused from, they put you under, they put a mask on you and kind of knock you out, and then they insert a tube down your throat, in your mouth, and it just apparently causes soreness. Definitely came away very sore. I feel like I just have a really bad sore throat. And they said that's typical. Well, my voice is starting to come back, and the sore throat's not as bad as it was last night. The procedure that I went through, I think I mentioned before, is called lithotripsy. And I think it's like a shockwave. They don't cut you open or anything. And I used to think that surgery meant, being cut open, and apparently that's just one type of surgery. There's all kinds of things that are called surgery. I was under general anesthesia for a couple of hours, I think. And even though this beam of, I think it's shockwaves, and it goes through your back, and it supposedly supposed to pinpoint the kidney stone or kidney stones in your kidney, and then the shock waves pulverize it. You end up very bloody. So even though you're not cut open, afterwards when you pee, you're peeing blood. And so if any of you get queasy on seeing blood, you may want to close your eyes, because I'm going to show you what it looked like. When I first got home, I decided to go ahead and photograph it. You have a little strainer, and you have to pee into the strainer to catch any of once they're pulverized, the little particles or the little kidney stone pieces are like grains of sand or smaller, and they're supposed to come out. And I do remember in the past they have done that, and it's a weird feeling, but at least it's not the painful feeling that you get from a big kidney stone trying to pass. And mine never do pass on their own. I have always had to go in and have them surgically removed. But I used the strainer, and so far, no particles have come out. Now, the doctor told me ahead of time, he said it's not always successful. It doesn't always work. So, you can go through all of this, and I guess they're not able to really see when they're doing it if they really are, if they all do get broken up. And so it may not have even been successful. I won't know for a couple of weeks. I have a post-op appointment where I go back and get another x-ray, and then they'll be able to see if they're still there. And hopefully between now and then, they will pass, and then I've got this jar that I'm supposed to put them in to take in, and then they can test them, see what kind they are. Mine, I've always had the same type. I forget the name of it. There are 3 different types of kidney stones you can get. Won't be full, but hopefully I'll have something to take into the doctor's office when I go back in a couple of weeks. And hopefully it worked. And so, but what I started to say about the blood, it kind of freaks you out when I'm not used to seeing blood in the toilet. And it kind of freaks you out, even though I have had this before. I don't remember this much blood, so I took a picture of it, and I'll post it here in case you want to see just how bloody it was. And then, so I've been drinking lots and lots of fluids, lots of water, lots of everything, trying to flush all the blood out. And so just for myself, I thought, let me just photograph and see what it looks like when I first get home, and then maybe an hour later, and maybe an hour or two later. And I did that, and I was really surprised that there was a lot of blood for the first probably 5-6 hours. And right around the time I went to bed last night, it was getting a lot lighter, it was getting pinkish. And this morning there's still a little bit, but not too much. So I feel pretty good about that, because they said you can have from really, really dark red blood to light pink blood for a few days afterwards, and that's considered normal or fairly common, I guess. So I'm glad that at least right now I don't seem to have much blood in the urine. So I think by tomorrow I should be fine, and even right now I feel pretty good, except as long as I don't stand up and do too much. And so I just want to share with you and let you know that the procedure went fine. Jim dropped me off in the morning at the hospital, and then they called him when it was done in the afternoon. He came and picked me up. You know, it was pretty easy. The hospital's fantastic. So my doctor had to reschedule with the hospital instead of the outpatient surgical center, and that was fine. I mean, they're right next door to each other, and people are so nice. The nurses, the doctors, the anesthesiologist, everybody there. I mean, I think I'm still a little loopy. I'm kind of going off on tangents here. Sorry about that. But where was I? I just feel exhausted, and I couldn't sleep last night, even though I was really tired. And I usually sleep really well, so I think it's probably just the anesthesia. I think they say it can take 24 hours to wear off, and it's only been maybe 18 hours or so, so I'm still feeling the effects, I think, of the anesthesia. I was thinking something earlier about the nausea and the vomiting, and I don't know about you guys, but I thought I would share this with you. I'm curious if this is just me or if it's maybe more common, but when I was a kid, I remember being sick all the time. I had 5 brothers, we all shared colds, and we all had everything you can get, every childhood sickness and cold and disease you can get, I think we got. And I just remember throwing up all the time, and it would be like this last minute violent vomiting, and I rarely even had enough time to get to the bathroom. So it was, we were always throwing up all over the floor. It was just disgusting. I feel so bad for my mom looking back, and she ended up cleaning it up. And how she survived 6 boys and vomiting all over the house for our entire childhood is beyond me. But I think I must have had just a weak stomach. And then when I moved out of the house, I got older in my 20s and 30s. Then I used to drink, not a lot, but I discovered that I have a very weak stomach when it comes to alcohol. And if I drink more than, like I can have 2 beers, light beers, and maybe 1 glass of wine, but any more than that, and I start getting really sick to my stomach, and I end up vomiting. So I learned, in my adult years that I can only drink so much, which is good, which is kind of funny too, because most of the rest of my family, I mean, they can just drink and drink and drink and drink. They don't get heartburn, they don't throw up, they don't get nauseous, nothing. But I'm the one who got the weak stomach. I think my grandmother also had a weak stomach. I don't think she could drink very much either. Now, in my old age, the only time I throw up is when I have some kind of procedure done like this. And like I say, every single time so far that I've had this done, I come home and I end up throwing up and passing out. Luckily, this is the first time. I do feel still a teeny bit queasy today, but whatever medication they gave me for the nausea really, really helped a lot. So anyway, just thought I would share that with you, and if you guys have had kidney stones, maybe some of this will be helpful to you, and at least let you know about my experience, and share with us in the comments section if you've gone through any of this and what your experience has been like. It's always interesting to compare notes, and some people have different experiences, and some people have found things that help where other things don't help. And I'm especially curious to know. I thought the lithotripsy always worked. I thought they pulverized the stones and then the gravel just came out. But then when the doctors said it doesn't always work, I mean, it's just sort of sometimes it does, sometimes it doesn't. That surprised me. So if any of you had this and where it didn't work, and then what did you do? Did you have to go back again after a certain point and do it again, or just wait? I mean, I'm curious about that. So I guess that's it. Jim's doing good. He doesn't get sick much. When he was working, he used to get sick. It seemed like all the time. Every couple of months he would get a cold, But now since he's been retired, he doesn't get sick, which is good because he's my Uber. He ends up driving me. I've rarely ever taken him to the hospital for anything. I mean, he just never has to go anywhere. Where over the years, he's taken me so many times for my kidney stones. As always, thanks for joining us. Although Jim isn't here today, I mean, he's in the other room, but he was a part of this experience. So thanks for joining us, and we'll see you next time.